My name is Rasu Shrestha. I'm the Chief Innovation Officer at UPMC. How many of you have heard of UPMC? All right, excellent. Go Steelers, right? Yeah, exactly. So UPMC is a fairly large payer-provider organization. This yin and yang of the payer and the provider. Keep that in mind, because we vehemently believe that that really is the basis of the formulary within which we're inventing the future of healthcare. So my discussion today really is titled Innovation as a Strategic Imperative. Right? For us at UPMC, we've been doing this for a while. There are a lot of provider organizations and health systems that encouragingly are actually getting into the innovation space. There are others that are also trying to invest and start companies and working with accelerators and incubators. We've been doing this for a while, and we've matured our processes quite a bit, learned from our successes and from our failures. And we've come to a place, and I'll paint the picture with regards to what our priorities are, how we're looking at innovation as a strategic imperative. We're putting all of our chips right in this bucket. We're saying this is the future of UPMC. For this $17 billion annual revenue company, 80,000 employees, that's UPMC today, this is the future. So what I'm going to do is really talk about where we are as an industry, right? That red dot that you're seeing there, strategic inflection point, that's where we are as an industry. So whether you're a small company, whether you're an entrepreneur, or you're a larger organization, or us as an industry, that's where we are. So we have a seed to growth, right? So we're talking about seed funding. We have a seed to growth, and there's some level of growth that you enjoy over time if you make the right decisions, and you have perhaps the right partnerships, you have the right IP, you make the right progress. And then, when you reach that strategic inflection point, which is, I argue, where we are right now, there are a bunch of decisions that need to be made, right? And based on those decisions that get made, you either enjoy this exponential growth, or you see a catastrophic decline. And there are many companies that have gone down the path of catastrophic decline, right? So, what I'm going to be talking about today is how we're viewing innovation as a strategic imperative. What it means for us from a payer-provider perspective to really challenge the status quo. I'll tell you the UPMC story. I'll tell you about how we're organized in our focus areas when we're co-creating and co-investing and really trying to accelerate the pace of innovation. I'll step back and talk about old world in terms of healthcare as we've known it, versus new world, this reimagined healthcare that we hope to be building together with the entrepreneurial community that you're all about. And then I'm going to end with data as the basis for reinventing the future of healthcare. Right? As we look at technology and innovation, as we're being inundated with data, and there's been lots of discussions about that throughout the 2 days, how do we make sure that data becomes the basis of humanizing healthcare, right? I vehemently believe that innovation, if done right, makes technology invisible. Think about that, right? Today, technology is this barrier that sits between us and the patient. So I'll talk a little bit more about how perhaps we need to rethink this entire paradigm. And as I'm going through this, the task at hand for you is, as you're anticipating the coffee break, do you agree with the things that I'm putting in front of you? What's your model, right? Don't just listen to the lectures to learn. I think there's a lot of unlearning that we all need to be doing in healthcare today. What are your priorities, and how do we build more bridges, right? So let's jump straight into this. Challenging the status quo. I vehemently believe, again, that complacency is really your worst enemy, right? So even for an organization like ours, fairly large, we've continued to grow, we've continued to enjoy the fruits of a lot of the right decisions that we've made and the lessons learned and the things that we've put in place. We believe that complacency is really your worst enemy. How do we make sure that we're innovating fast enough and in the right direction to put ourselves out of business before someone else comes and puts us out of business? That's really important. Think about that, even in the things that you're doing specifically. So a couple of quick examples. How many of you know what this is? This is a 5 megabit, just a 5 megabit hard drive being transported by IBM in 1956. 5 megabits. That's right. Megabytes, excuse me. So the evolution of storage, right? Again, the storage industry didn't accept complacency, right? And if you look at 1 gigabyte of storage, not 5 megabyte, but 1 gigabyte of storage, in 1984 it cost $50,000. In 2012 it was 10 cents for 1 gigabyte, and today you get 15 gigabytes when you sign up for a Google Drive account. Revolutionary, right? So it's not just evolution, but revolution. So here's the second example, right? So that was in the storage industry, and this is not just revolution, but not just evolution, but revolution in a city. This is Pittsburgh, or was Pittsburgh. This was where steel and coal, right? And this was the epicenter, in many ways, of the industrial revolution that basically built the America that we know today. The new Pittsburgh is nothing like that, right? Self-driving cars, massive advancements in AI and machine learning, working with Carnegie Mellon University, with the likes of Google and Facebook that's in town. They acquired Oculus Rift and made their headquarters in Pittsburgh, right? Uber came into town and acquired 40 of the engineers that Carnegie Mellon had been building painstakingly this program around autonomous self-driving cars. And overnight, they said, all right, Pittsburgh is going to be our headquarters for self-driving car technologies. Argo AI, yet another AI-based company that's building self-driving car technologies, also headquartered in Pittsburgh. So the new Pittsburgh really is not one that's exporting steel and coal. Our new export commodity is eds, meds, and tech, right? Education, medications, or medicine, and technology. So a little bit about UPMC. There are 40 hospitals or so at UPMC. 3 of the ones that you see on the top are our specialty hospitals that are based in Pittsburgh. And the 3 others that I've painted right at the bottom are the 3 new hospitals that we just recently announced. So we made a really big announcement. I don't know if you saw some of the announcement. I put it up on LinkedIn, and I've been sharing it on Twitter as well. But we recently made a really big announcement that we're going to be investing $2 billion in building 3 additional specialty hospitals in the city of Pittsburgh. There aren't too many cities globally that will have 6 specialty hospitals all in one city. The new thing about this, in the theme of innovation and what we're talking about today around value-based care and the strategic imperative towards innovation, is that with the building of the 3 new hospitals, there will be no new beds. These are digital hospitals. No new net beds, right? So these are digital hospitals that will really be leveraging the capabilities that we're innovating towards in terms of science and medicine, and hopefully the art, as was discussed earlier, and the balance in trying to put all of this together. So I'm going to quickly show you a video that talks about our bold ambitions as we're making some of these bets.
There are days for dreaming, days for wishing. Today, we build. Not just walls and halls of medicine, but whole new ways of delivering patient-centered care. Inspiring new collaborations and things yet unimagined. Today, at UPMC, we build the future and make life-changing medicine happen.
So that's essentially what we're trying to do, is our tagline, life-changing medicine. How do we make life-changing medicine happen? How do we innovate to make sure that we're able to reinvent that future and create this future that actually resonates not just with the current definition of healthcare, but the newer definition of healthcare moving forward. So I mentioned earlier we're this large yin and yang of a payer-provider organization, right? So in addition to the close to 40 hospitals that we have and the 80,000 employees, we have a health plan that actually has 3.5 million lives that we cover. And it's really interesting, this yin and yang of the payer-provider system, right? So it's not just a patient-centric approach to care that we're caring about, that we're algorithmizing and we're building into our solutions and the companies that we're creating, or a member-centric approach to care, which is what health plans typically look at, but more of a person-centric approach to care. Think about this, right? Because that person could, the consumer, that person could be a patient at any given point in time, most likely is a health plan member, has some insurance coverage, but as you're looking at the shift in risk, that's primarily it was being borne by the payers. It's now moving towards the providers, and soon it's moving towards the consumers. The consumers are going to be bearing the brunt of the risk in many ways in the coming years. How do we make sure that we manage and mitigate those risks? How do we make sure that we have enough data and transparency and the right tools and the innovations to actually manage that payer-provider yin and yang? So what we've done at UPMC is we've focused on a number of different areas. The way that we're organized is we've got the insurance services division, we have the provider services division with the hospitals, physicians, nurses. There's the international division, and then there's the enterprises division, which is really where I park my car every morning, right? So in addition to being the innovation officer across UPMC, I'm also the EVP for UPMC Enterprises. And Enterprises really is our innovation and entrepreneurship arm at UPMC. It was mentioned yesterday that the innovation center in, I think, Texas was in a Nabisco factory, old Nabisco factory. Well, we too are also located in a Nabisco factory. So there has to be something about a Nabisco factory. So it's the new garage, I guess, right? So Bakery Square is the name of the building that we set shop in some years back. This is also the building where today Google is headquartered in Pittsburgh, and Google has hundreds of employees upstairs. So what's really interesting for us is as we're continuing to innovate, as we're continuing to look at and put our money where our mouth is, right? Because we're also active investors. We're founding companies, we're with venture capital funding, we do angel investing. So we're all of the above and none of the above, meaning we're not just a strategic buyer or a founder or an angel investor. We're really a strategic, if you look at it, because we co-invest and co-create. Right? So obviously we sign checks and we put our money where our mouth is. But in addition to that, we bring data. So we have 27 petabytes worth of data at UPMC. That's doubling every 18 months. Across this payer, provider, patient-entered data, all types of data. But then we also bring in our expertise. We bring in the living lab, that's UPMC, and say, all right, how do we increase the chances of success for that innovation? How do we increase the chances of success with the work that we're doing with that entrepreneur, with that startup? So there are 4 areas of focus for us at UPMC Enterprises, very quickly, and all of this information is also available on our website, upmcenterprises.com, or you can follow me on Twitter or look at hashtag UPMC Innovates. Translational science, we just committed to a $200 million investment over the next 5 years in translational science. Improving outcomes, so clinical tools and population health really coming together, again with the mindset of this payer-provider yin and yang that I referenced earlier. Consumer, not just the next cool app that we'll upload into the App Store, into the cloud, but really if healthcare is moving away from those hospitals that I talked about earlier into the bricks and into patients' homes and their smartphones and their pockets, what does that look like? What do those business models really look like? How do we create those companies that actually sustain the future of this bold new world? And then infrastructure and efficiencies. You heard quite a bit earlier about some of the waste that exists in healthcare, the inefficiencies that exist in healthcare. So whether it's around supply chain or revenue cycle management or all of the waste that exists in the back-end offices in healthcare. So we're trying to bring in AI and machine learning capabilities and finesse to really address those challenges. What's also interesting is that we're capitalizing on the fact that we're a large, strong academic medical hub, one of the largest medical training programs in the country. We're affiliated with the University of Pittsburgh, which is top 5 in the NIH rankings when it comes to research funding. And then we have Carnegie Mellon right in our neighborhood here, where we're able to capitalize on the machine learning AI specialists across the board. So it's interesting. So Google is upstairs in the Bakery Square building, and we're competing with data scientists. We're competing with data analysts and product managers and engineering folks. My innovation team today is 250 individuals. So we have about 70 or 75% of them are IT-focused designers and product managers on top of that as well. So that's the culture that we've created at UPMC Enterprises. I'm a big believer in culture. It's really important for you to make sure that you're able to create an environment where the walls are much lower, you're able to collaborate, you're able to ask questions, you're able to call bullshit on solutions that you think are questionable or not in the right direction. And you're able to learn from your failures, right? So we talk a lot about fail fast, but that's a culture that we've actually embraced at UPMC Enterprises. Agile development methodologies, human-centered design, these are principles that we've really embraced, and as a result of that, the solutions that we've created are fairly tremendous. A quick snapshot of some of the portfolio companies that we've either birthed out of UPMC or we've invested into, and in all cases, we're co-creating and co-investing. Right? So we're building these solutions, we're implementing these solutions at UPMC, we're then taking these to market with the right levels of partnerships really across the board. So I'm going to take a step back and really contrast sort of the old world to the new world and give you the perspective of how we view innovation as a strategic imperative, how we're actually looking at the design of these solutions that we're building moving forward. So a lot of you, I'm sure, have seen the hype cycle. This is the hype cycle for emerging technologies, the more recent version from Gartner, 2017. And there are all sorts of hype out there, right? Smart dust is right at the start of the hype cycle there. It's 4D printing. I mean, I know a lot of you have heard of 3D printing. I had, and I was like, what's 4D printing, right? What's the fourth dimension in that printing thing that you're doing with your printer? Neuromorphic hardware, quantum computing is coming up, right? Connected home, now that's becoming more of a reality, and in fact, there are a number of things that we're innovating around in that space. Cognitive expert advisors. So my point in putting this slide up there is that there's a lot of hype out there. But what's really important as we're investing, as we're innovating, as we're creating these solutions, is to balance that hype and the hope that exists in healthcare with the reality of what academic and scientific rigor can really bring to the table, with the reality of what the living lab, like one that we have at UPMC and UPMC Enterprises, can really validate and prove. Because you don't want to be blinded by these buzzwords, right? That's the last thing you want to invest around is a buzzword, right? So it's really important to make sure that you're going in with eyes wide open. I mentioned this briefly earlier. That's the new reality of what we've created with all of the digitization of healthcare that we've been so successful in doing in the last 20, 30 years. We've erected this large, big wall that sits between the patient and us as clinicians, right? Many times, and I know the AMA agrees with me on this as well, technology tends to be an impediment to care. How do we make sure that technology can really be an enabler of better care? Right? So those are some of the concepts that we're putting into picture. So really quickly, I'm going to run through this, contrasting old world with new world. So in the old world, we've been designing for regulations. And nothing wrong with HIPAA. Admittedly, there's a lot of HIPAA-noia in our community here, right? Nothing wrong with ICD-10. You know, this billing is important and coding is important. But how do we not just design for regulations, but really design for empowerment? Patient empowerment, clinician empowerment, designing for empowerment. Burnout, there was a lot of mention of burnout earlier. How do we make sure that we're not building solutions that create burnout, but really joy? When was the last time your clinician went in, or you went in as clinicians and said, I'm so joyous, we're going live with the solution today? Never, right? Never. Innovation today is about adding solutions. It's about adding bells and whistles and product features, and you really read the release notes, or you look at the new features that get added on. It should really be about simplifying. It should be about subtracting. It should be about taking things away, making things less complex. Today, healthcare in large parts is about bureaucracy. How do we get to meritocracy, right? How do we reward merit as opposed to be inundated with bureaucracy? These are the things that we're trying to think about as we're innovating, as we're making our bets, as we're putting our investments forward. Today, healthcare is very application-centric. Is it PACS-driven or risk-driven? I'm a radiologist by background, right? Is it this app? Is it this EMR? It should really be patient-centric. Today, healthcare is very interpretation-centric. You're going in and you're trying to make that diagnosis. Was it calcification? Was it a nodule? Was it a tumor? What stage is it? Again, that's important, but it shouldn't just be about the interpretation. It should be about outcomes, right? And then last but not least, today, every investment that we've been making, right, the millions, billions that we've been spending on Epic and Cerner and enterprise data warehouses and cloud and infrastructure, it's been about doing digital. It shouldn't just be about doing digital, it should really be about being digital, thinking digitally, not just replicating analog workflows in a digital format and creating e-files and e-folders and hanging protocols. We don't hang film anymore. It's not film anymore. We talk about wet reads, right? It's a wet read, a quick wet read that we're providing to that ED physician. There's nothing wet about that film that is not a film that we're not hanging. Okay, so how do we make sure that we're not just doing digital, but being digital, thinking digitally, representing data in ways that we could never have represented in the paper-based world? Think about that, right? So those are the imperatives that we're trying to really push forward with. So data as a basis, I'm going to be really quick about this because I'm running out of time. How do we make technology an enabler of better care? You all know this. There's data everywhere. Data is telling stories about you and your loved ones, about your kid, about that last blood pressure exam that you had, the radiology exam that you had, your cholesterol level. Data is everywhere. But what's really interesting is that the data that we have access to today, the debates that we have going on in the policy world in DC and in other areas around interoperability, it's really just the tip of the iceberg, right? It's the data that we have within our EMR solutions and our enterprise data warehouses and in our data centers. But the data that we're really concerned about aren't just the data within the EMR solutions. It's the data that's outside of the hospital systems as well, right? The social determinants of healthcare data, for example, data around economic status, about the environment that you live in, the behavior and the behavior change that you want to try to bring in to that person, not just the patient that you've admitted into your hospital, but the person that you're trying to really treat. So how do we make sure that we're able to get access to all of that data? Because today, 90% of the data in the world has just been generated in the last 2 years, right? 2.5 quintillion terabytes of data are generated every day. That's ridiculous. Across the board, not just in healthcare or in my radiology practice, but really across the board. That is amazing. This tsunami of data set that's hitting us is remarkable. So it's not just about the data, though, right? Because we talk a lot about data and we emphasize data as a basis of innovation, but it's about information, knowledge, and converting that knowledge into insights. And then marrying those insights with evidence-based guidelines and best practices and clinical protocols and trying to get to behavior change, because that's what it's really about. And how you get to behavior change is through nudges, right? How do you create those innovations that create those nudges for clinicians, for patients, for our consumers, for our administrators? That's what it's really about. So that's the mindset that we're actually trying to bring to the table. A quick example, this is one of the innovations that we've been pushing forward at UPMC. What we're doing is we're risk stratifying our patient population and our chronically ill patients. When we discharge them from our hospitals, we're discharging them with not just a bag of pills and a discharge summary or a discharge instruction. We're discharging them with technology. So we're remotely monitoring these patients with their permission, leveraging these capabilities, these technologies that we're discharging them with, and they're risk stratified, fully managed kits for the highest risk. We've got mobile apps and tools, and then web interfaces where they're actually inputting data for the rest of the population. And we're able to send all of this data into this intelligent hub that goes in the back end. And before the patient then falls off the guardrails and ends up back in our EDs, we know that they're about to fall off the guardrails. We're then able to intervene actively, right? Those nudges that I talked about earlier, right? We're able to use those nudges to get the patients, those consumers, back towards the circle of wellness, which is where we really want them to be. So, and it's amazing, the results have been absolutely tremendous. Patients have been feeding back that I did everything that I wanted to, right? Their specific preferences and what they wanted to do. So we think that healthcare shouldn't just be about curing disease. It shouldn't just be about surviving. Healthcare should be about thriving, right? We believe that it's not just about adding years to life, but really about adding life to years. A lot of focus on the silver tsunami that we're calling, right? This senior care, long-term care, post-acute care as well. We believe that despite everything that I talked earlier about and the announcements with the $2 billion investments that we're putting in the 3 new specialty hospitals, we believe that in the future, if our beds are filled, it means that we've failed. And those are the types of innovations that we're actually creating at UPMC to make sure that we're able to really reimagine a future that brings forward the very best of what we need for our patients across the board. And at the end of the day, it really is about building bridges, right? Pittsburgh is the city of bridges, right? 440 bridges in Pittsburgh, more than even Venice. It's about building bridges between the old world to the new world, as I painted earlier. It's about building bridges to how we've known healthcare to be, the definition of healthcare as we know it today, to the newer definition of healthcare, where we're talking about not just survival, but thrival, where we're talking about healthcare that's well beyond the walls of the hospital, about taking in data elements that are well beyond the specifics of the data elements that we're struggling with today. It's about bridging the likes of innovators and entrepreneurs and those that are financing these innovations to the realities of the needs of patients and the payer-provider yin and yang that exists out there, whether or not we get to a single payer reality, right? The reality is that providers need to work more cohesively with payers, whether it's through accountable care organizations or value-based models that are out there. So it's really about building those bridges. So with that, I know I'm out of time. Please follow me on Twitter, engage with me, continue to have discussions with us, and if there's anything that we can do from a UPMC perspective, even as we explore partnership opportunities with you, please let us know. Thank you.
Thank you, Rasu. That's awesome.
Thank you.